Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, in the treatment of rheumatoid arthritis, the first drug which is used is NSAIDs. These NSAIDs are non-steroidal anti-inflammatory drugs, right? So these we in for the rheumatoid arthritis, we start the treatment with NSAIDs. So the best initial treatment for the rheumatoid arthritis is NSAIDs. They will help the patient to quickly control the signs and symptoms, and they will also control the local inflammatory process also. They will also control the local inflammation that is happening in the rheumatoid arthritis in the joints. Then it has no effect on progression of the disease. For the progression of the disease, to stop the progression of the disease, we can use disease modifying anti-rheumatoid agents, but non-steroidal anti-inflammatory agents, that is NSAIDs, have no effect on progression of the disease, right? So acetaminophen is usually, it is not used because acetaminophen is usually not used because has it does not have any anti-inflammatory properties. Because of the lack of anti-inflammatory properties, acetaminophen is not used. Then, but if a patient has rheumatoid arthritis and hemophilia together, in such cases, if the patient has rheumatoid arthritis with hemophilia, then acetaminophen is the treatment of choice in this condition if the patient has rheumatoid arthritis with hemophilia.
thank you and thank you for watching.